This is the primary screening methods worksheet of the C4P Success tool. This is where you will be telling the tool what proportion and what kinds of primary screening methods you will be using in each year during your scale-up period. Pay attention to these areas here where you're going to be making selections and changing the proportions of the different types of screening methods that you intend on using over the years. There's 4 screening methods that you can include here. And the first one is the HPV DNA test sample collection, which is provider collected. That's different from the HPV DNA test sample collection self-collected. In the case of the self-collected, a provider will give a collection kit to the person. They will go in and they will collect the sample themselves, and then they will give it to the provider for processing. In the case of the provider collected HPV DNA test sample collection, the provider will actually do the actual collection for the woman as well as processing it. There's also visual inspection with acetic acid for primary screening using the screen and treat method, which means that if you do VIA as a primary screening approach, then you will be screening and doing immediate treatment of either ablation or, if possible, also excision right after you have done the visual inspection with acetic acid. And finally, there's cytology primary screening, where you'll be doing screen, triage, and treat approach, which means if your cytology results come back where it's atypical or has a non-normal result, that you will be sending people in for a colposcopy. So that would be screen, send for colposcopy and triage, and then decide what treatment is going to be done. For each one of these cells, you'll have a drop-down list that once you click in, you can say what percentage you're going to be using this. If you're not going to be using a particular type of primary screening method, then you just want to set that to 0, which means that there won't be a use of that at all. So just for the examples here, I'm going to be saying that there are going to be no provider collected HPV test DNA sample collections. Then next you can go to the next type of primary screening method. And in this case, I might say, well, I'm going to start off with a 25% HPV DNA test sample collection. And then I'm going to try to increase that to 35%, and then 45%, then 55% here, and then finally up to 60%. So here I've decided that the proportion of these that I'm going to be using, which now of course it'll be 3, is going to be 25% and then all the way up to 60%. So you can see how that changes over the years. The nice thing about this particular tool here is that it reminds you that you have to sum to 100%. So it'll tell you if you haven't summed to 100% yet. So let's say I'll say, okay, well here I'm going to say that 70% of my screening collection, or my screening at first, is going to be visual inspection with acetic acid. But I'm slowly going to start reducing that to 65%, and then 55%, and then 45%, and then 35%. You'll still see that I have more than 100% here because I have 0 here. So I'm going to say, okay, well, looks like I'm just going to do 5% of cytology. And let's say I keep that at 5% as we go along. So now I see that I still have 70% here and 65% here. So I'll want to then reduce that to 60%. And now I'm fine. Reduce this here to 50%. And now it tells me I'm fine. This to 40%. And then again, this to 35%. So you'll see now that while I'm increasing or introducing the HPV DNA test sample collection, at the same time, then I'm reducing my use of VIA or visual inspection with acetic acid as a primary screening method. You'll get results right away, which is nice here. You'll see here that these are the numbers of self-collection testings that you're going to need to be doing. 2024, 25, 26, 27, and 28. And also the number of VIAs that you're going to need to be doing here. And you'll see that that goes down and then it goes up a bit and then it goes down. And then same with cytology here. So it's going to basically tell you what capacity you're going to need to have at a minimum to be able to provide these screening methods to the target population that you've already suggested with the screening goals that you've already set. This will also tell you the probable results from your primary screening as you go through. So you'll get an idea of the number who probably be HPV positive, cytoabnormal, those who will probably be seen with small precancerous lesions visible, and also for large precancerous lesions visible, and also those who will be identified most probably with suspected cancer visible. And that will help you with your decisions about ablation, excision, and also give you an idea of what the burden will be on your cancer diagnosis and treatment centers that you have either within the country or those who you contract with outside of the country. So that's it. You just want to make sure that you play with these here to make sure you get 100%. And you can see pretty clearly what the outcome is going to be of changing your approach and the proportions of each type of primary screening method that you're planning on introducing or using over the 5 years.